Tatiana, welcome again. You've been on this now, what, 3 times, I think, or third time? I'm losing count. So we have a pretty busy schedule today. I'm going to try to keep my part shorter, and then we'll end around 10 minutes before 3 with some updates, and maybe if there any more time left, we'll do some more questions. So I have 2 main quick topics. The first one was brought up by one of our listeners, and that I think what I'm going to do is trying to decide if it's easier to just share the screen and show you guys one article real quick. Okay, so this was just published a couple of days ago in BBC. So it's an interesting point. I don't want to make much of it, but basically the gist of this article, and I'll put this in the chat, is interesting question. Is it possible that non-COVID common cold viruses are actually in somewhat protective against COVID, and sort of what does that mean? And I kind of recommend for you guys to read it. And one of the main reasons is very simple. The immune system is a very complex entity, and when we think of infections, we tend to think of them as bad news. The reality is way more complicated, and I think idea that certain mild infection can actually be stimulatory to the immune system and semi-protective, and maybe we should not be as afraid of them, like let's say a common cold. It's an interesting comment. So I think it was I think it was Stephen who brought this up, and I'm sorry if I forgot who exactly brought this up, but I thought that was a very interesting article to review. Okay, so I'm putting the link in the chat. This is the actual link to BBC News. So that's one. The second is, I was thinking about, it's going to be a second summer of the mess, right? So how do we now approach the upcoming vacation season, since some of us have been vaccinated, some of us not? I thought of how I'm going to organize this couple of minutes last Friday. That is before the news that we're actually seeing a pretty significant uptick in cases, and there's a massive warnings from all over NIH and CDC that we're going to see another spike, and it could be a pretty significant spike. And in the last couple of days, we've seen 7% increase in cases. Interestingly, most of those patients are younger, but they're sicker. And it's because most of those new cases are actually more virulent cases. The Brazilian case, the England case, the virus, forms of viruses. So they're more contagious, and initially we thought they are less virulent. Turns out that they are probably more virulent, or at least the same virulence. They're just more contagious, not just more contagious, but also more severe illness. So unfortunately, my original idea was to tell to everybody, if you're vaccinated, maybe it's time to start allowing ourselves to get out there and, release the pressure of being secluded and starting to kind of be, maybe I should kind of scale down this discourse until we see what actually happens with this new possibility of another, hopefully minor relapse. Of course, the recent news about Florida gatherings, and people are really relaxing and kind of going out there and doing crazy things.
Break effect.
Yeah, so unfortunately, I think that's all sending the vibes that we're not quite out of the woods. And I think the idea is, if we're planning a summer vacations in a small group and everybody vaccinated, my recommendations are still in line with CDC and they haven't changed. So if everybody's in a group vaccinated, you don't need to use masks. I think the CDC still stands behind that statement. Otherwise, to travel, whether you're vaccinated or not, you still have to use all the maximum protection and sort of simplify and minimize the travels, especially in a public modes of transportation like trains and planes. So I wish my spiel was going to be a little different, but on Monday, Tuesday, I started following the news and I realized I can't really give you a different spiel yet. Good news is that it seems like vaccination campaign is going really well. I hope that most of you, or some of you at least here, have already finished second vaccine. I know many do. So I see Nadia's lifting thumbs up, and Irene and Salome. So Judy, Jennifer. Good. So, I mean, the people on my screen, out of 4 screens, many of them are lifting thumbs up. So that's good. So hopefully that does mean that we're going to see a shift. The hospital, unfortunately, is in line and actually seeing increase in cases. And what's a little more concerning is that the cases are often get discovered not immediately. So that is probably to do with the fact that the whole system has been kind of fatigued, and some of the things that we've used to do in a much more scheduled, immediate basis, we're changing the flow of things, even though everybody's still tested on intake into the hospital, but more tests coming back negative just to be discovered later to be positive. That's not very clear if that's related to the new variants or not. So that's all I have for the updates. And let's go to questions, I guess, from here. Janet, I did not see specific questions. I did brought up one topic already, but other than that, I have not seen any specific questions before. So everybody, if you have questions, put them in the chat. I'll start with Sheila's question. Once one is vaccinated, if you have COVID, does it go away, and does the vaccine protect you from getting the virus if you're around an unvaccinated person? Okay, let me just get the question right. So generally speaking, we don't vaccinate patients during the acute COVID. There is a concern that if you're trying to stimulate the immune system on top of an inflammatory response, it may not be a good idea. So usually we wait for, it's not exactly clear how long to wait after someone recovered. Some hospitals or some systems do 4 weeks. Some systems don't do much. As soon as you recover, you'll get a shot. I don't think there's very clear guidance from CDC on that. I did see the numbers of anywhere from 4 to 3 months, or I'm sorry, from 4 weeks to 3 months. But I don't think that's very clear. I think once you're vaccinated, you're relatively protected. That's the whole point of vaccination. So if you are hanging out with a person who's not vaccinated and a carrier, you're sort of protected. The original conversation has been, and can you then still pick up the virus and transmit to somebody else, right? So that's one remaining big unknown. The Israeli study from, I think, 2 weeks ago have shown that the risk of transmission dramatically went down with Pfizer vaccine. Is this going to stand true in our population? We yet to see that. I don't think, I have not seen any data, and I have not seen any additional communication from CDC or GW leadership on this topic. So we're still basically saying if you're hanging out with an unvaccinated person, you should be using protection, no matter what your status of vaccination is, mostly because we don't know if you can pick up a virus and transmit. And even though the Israeli study is encouraging, it's not conclusive, I would say.
Okay, Dr. Kogan, my first question, you have unsymptomatic or because they say many people have asymptomatic COVID, they're active. So if I get vaccinated, does the asymptomatic COVID in me go? I mean,
okay, that's a good question. I think I understood what you're just saying. I'm glad you spoke up, because I don't think I got that point.
Yeah, that's what
so I think if you're asymptomatic, it's not very clear whether you just had a positive test because you carrying, but you don't actually have any inflammatory response to the virus, or the response is very mild, you're just not feeling it. If there is no response and you're simply a carrier and you never actually had the disease, you just have a virus, vaccine is very reasonable. The question is it a good idea to give you a vaccine if you have such a mild symptoms, you're not feeling much of anything? And should you wait a little? Again, I don't think there's a good answer on that. We do know that even with a mild illness, you're protected for a while after the infection. With the moderate disease or disease that came to a clinical setting attention, you can be protected beyond 6 months. There's just the studies that have been coming out that patients who have had the virus relatively protected to about 90% efficacy. So it's kind of not far off of the actual vaccine. But your question has more to do, is it safe for me, right, Sheila?
Well, and there's so many people with COVID. If you haven't really been tested and if you haven't really had any symptoms, but you still could have COVID. So once I get vaccinated, and when everybody gets vaccinated, does it wipe out the COVID that I had that I didn't even know about? Am I COVID free after that, or?
Well, so don't think of that, because it's not really.
Is it still in there?
Yeah, like that doesn't happen. So vaccine is not like, first of all, I think whether you're carrying the particles of the virus inside it, kind of irrelevant, because in a way, once the virus passed through you, whether there's some leftover particles and your test is positive, probably doesn't mean a whole lot. In fact, if you only been diagnosed, quote unquote, by a test, there's a very significant probability that test is false positive. You following? So it's hard to address this question without certainty, because you don't know whether you actually had the virus or you just tested positive. That's always a clinical dilemma.
I never was, so I don't even know.
That's right. So if you have no symptoms at all, it's a hard call. I would say definitely get the vaccine, because you don't actually know whether it's positive.
Well, I'm already in the process. I already got the first shot, but I'm trying to find out how much protection I have once I am fully vaccinated. Am I a transmitter anymore? Am I not a, how much of this can I depend on just walking around now at some point in the future, kind of feeling good about it, all of it.
Right. So you probably, after second shot, let's say 2 to 4 weeks after second shot, you're going to be 90+% protected. That's clear. Whether you are now not able to transmit the virus to somebody else, let's say you have been in contact with unvaccinated person who was carrier, question, can you be a carrier now? So we don't have the data outside of what I mentioned about Israeli study that's showing, yes, you are sort of protected now from being a carrier. I think we have to wait for more data.
Okay. All right. Thank you.
That's good. Okay, let's move down, okay? And I'm going to finish, I think we're going to finish a little earlier, not at 2:30, but I'm going to finish it around 2:25. So maybe I'll take 2 or 3 more questions and then we'll stop at that. So question is here from Elizabeth. How long should I wait to get vaccinated for shingles after my second COVID shot? That's a hard clinical question. I would prefer not to answer it, because I would need to know way more about you to be able to give a good answer. I don't think it's an easy, simple sort of, get vaccinated whenever. It depends on lots of different factors. If you can, I would wait. How long, I don't know. Again, it would depend on sort of your current health status. So I'm sorry I can't answer this well. Salome is asking, if you're vaccinated, does it mean we're protected from variants? That's a great question that's been currently aggressively studied. At least for now, it appears that both Moderna and Pfizer are sort of protective against African, English and Brazilian strains. AstraZeneca, you guys all probably heard, is under fire, not really clear. Not that we really care. We don't have it here. Johnson & Johnson is a little trickier, but I think they're also claiming it's relatively effective against the strains. So far, there hasn't been a lot of reports in patients getting sick with new variants after the vaccinations. At least I have not seen the cases described. So, all right. Email Dr. Kogan office, you would like the COVID vaccine prep kit. Okay, thank you, Janet, for putting that in. Israeli, okay, Kathy's asking, considering the Israeli study with Pfizer, are you still advising travel restrictions for those who had? Yes. And the reason is, until we see the confirmation of that study in our population, I would probably not. It's only one small population. It is a different population. They're more homogeneous. I don't know if that, they're also potentially may have somewhat different epidemiologic practices in a smaller country. So I would say we have to wait for our own data before we can start sort of discussing this. Plus, on top of that, unfortunately, even if you do travel, you're going to have to be forced to use the precautions. I'm just saying. It has nothing to do whether you're vaccinated or not. It's a universal precautions that all of the travel agencies enforcing. Okay, no, we're doing well time-wise. So should you get a COVID test before vaccine to ensure you aren't symptomatic? No, right? You're symptomatic or you're not symptomatic. So if you're not symptomatic, you should get the vaccine. If you're symptomatic, get tested. But if you're symptomatic, then you should be talking to your doctor, right? Regardless. So I think that's a good question from CJ. By the way, the typical antibody tests do not test whether you've been vaccinated or not. They're not able, unfortunately, there's no test to separate vaccine from an actual infection. They are currently being developed and they're available for research purposes only. I'm not aware of actual clinical labs doing those tests. So if you ordered antibodies, even if they come back negative, it doesn't mean you have or have not had vaccine. Moreover, it doesn't even mean that we know whether you've been infected or not. Unfortunately, the antibody tests are not very good, so they're not very helpful. Okay. All right. What is the difference in generation of antibodies to the COVID from having the illness and taking? The great question. Is this Irene asked? Yeah. So Irene and everybody, the answer to this is it depends. So the tests have been developed not against the spike protein, to my understanding. So when they look for the antibodies, they're not testing the proteins in the spikes, in the viral spikes. The vaccines are to the spikes. That's why the test that's currently at LabCorp and Quest cannot test whether you've been vaccinated or not. Does this make sense? Is it helpful or was that not your question? Just unmute yourself, Irene. It's good? Okay.
It is the question, but it was a little confusing.
Well, yeah, why wouldn't they develop the test against the spike? I don't know. I'm not sure. I'm guessing it has to do with the complexity of the testing and also the test early been evolved and developed quickly. It's possible that we're going to see different generations of tests in upcoming months. So that's the best, unfortunately, I can respond. Yeah, so I do test antibodies on a number of my patients, but I am not yet clear what truly use of this tests are going to be. And I'm seeing a very few positive tests, very few, even in the patients who actually had the disease. Even though the CDC is now coming out and saying the data seems to be that we actually, even those patients who are antibodies negative are probably still protected to some degree after the infection. So, okay. COVID rapid test, last question, okay, from Cecile, and then we're gonna go to Tatiana. What is COVID rapid test? So that's typically what's thought of as an Abbott test with whether there's a antibody test where you swipe, the saliva checked or a nose, and the test is generated in a little kit with the antibodies in a little bit. So it looks like a pregnancy test. That one carries a very high false positive, false negative rate. It's never acceptable for any serious checks. It is only FDA approved when somebody is symptomatic. It should never be used in asymptomatic population. Unfortunately, many places using this test as screening in asymptomatic population. I don't want to comment on anybody's practices, but from actual evidence perspective, that's a bad idea because you're gonna more likely to find false positive than a real case detection, and that creates all kinds of consecutive problems. If you found false positive and you think that patient actually had a disease, but they're actually negative. So yeah, so Cecile, that's unfortunate that you've had that. Your lump had nothing to do with the viral symptoms, right? So this was just and that's just the test that they were doing. Again, a lot of places doing it because it's two reasons. It's financial and also practical. Financial, any company can purchase the device that does it and then the actual cartridges for the device, and it's very easy and quick and relatively inexpensive. That doesn't really make it it doesn't make it best test at all. In fact, I'm not even sure of the value of it. Okay, well, that's all my time for now. And again, welcome Tatiana, and please lead us into mind-body part of today.
Thank you so much for having me, Janet and Dr. Frame and Dr. Kogan. It's such a pleasure to share this space with you all this afternoon. And so when I was thinking about what mind-body practice I wanted to share with you guys, the one that immediately came to mind was one we call 3 drawings. And it has a very scientific name, but essentially it enables you to really tap into your intuition. And it's a practice that we use at the beginning of all of our mind-body skills groups at the Center for Mind-Body Medicine. And mind-body skills groups are essentially our signature model for relieving stress, relieving trauma, augmenting resilience. And they're generally a series of 8 meetings with 8 to 10 people where you practice an experiential skill and then you share in the context of a small supportive group. So we're really mobilizing social engagement as a way for healing. So before we get started, I did want to share just one contraindication. Sometimes heavy emotions can come up during this exercise. So I just wanted to make sure everyone is aware of that. And I also just wanted to mention that when we do 3 drawings, often people get really self-conscious, you know, they'll kind of reminisce on experiences growing up where their art teacher was like, oh, this isn't good enough or that. And I want to kind of just let you all know that every single one of you is going to have different drawings and every single one of you is going to have exactly the right drawings. So I want to preface this experiment by saying that. So what you'll need, again, is 3 pieces of paper and something to draw with, write with, color with. And before we get started, I just want to take a few moments and just come back to our breath, maybe feel your feet on the floor. Just breathe in through your nose and out through your mouth. And just continue breathing like this for maybe 10 or 15 more seconds. And then when you feel ready, I want you to open your eyes. And on the first piece of paper, I want you to draw yourself as you are now, whatever that means to you. So again, the prompt is you as you are now. And we'll take about 3 minutes for every drawing. And as the Zen Buddhist saying goes, first thought, best thought. So don't censor yourself, just draw whatever comes to mind. Maybe take another minute or so, just put on any finishing touches that feel important. And when you finish up, I also want to encourage everyone to write 1 in the top left corner of their drawing, so we can come back to these. Okay, so let's finish up that first drawing, put it to the side, and then I want you to take your second piece of paper, and on this one, you're going to draw you with your biggest problem. And again, we'll take a couple more minutes for that one, about 3. So you with your biggest problem, whatever that means to you. So take about another minute to wrap up. And again, as you wrap up this drawing, you might want to put a 2 in the top left corner, just so we can come back to these. Okay, so wrapping up number 2, and you can just put it to the side like you did with the first drawing. And then for the third drawing, on the third piece of paper, I want you to draw you with your problem solved. So again, it's you with your problem solved, whatever that means. And we'll take about 3 minutes for this one too. Take about another minute just to put any last touches on you with your problem solved. And a 3 in the left corner of your drawing. Okay, so go ahead and stop there. There might feel like things that still need to be added, but you can always come back to these later. And now I just want to encourage everyone to take their 3 drawings, hold them all side by side, and look at them and see what you notice. Maybe forms, how you drew yourself, how you represented yourself in each drawing, the mood, maybe the position of where you are on the page. And I'd also like to go ahead and open the floor and see if anyone wants to share their drawings with the group. This is something we do in our mind body skills groups, and it's often very helpful, not only for the person who's sharing, but also for the other people in the group. So anyone want to be the brave first one to share their drawings?
I'll share.
All right, go ahead, Irene.
Okay, this is me as I am right now. Very literal. I'm wearing a blouse. Ha ha, he he, I'm happy. I look the way I should look right now. Should I go on with the others?
Yep, go ahead to the next
Okay.
one.
The one with my problems. My mother, who's 100 years old and is very reproachful. And what I do is yell. And the problem is mine, not hers. She's not the problem, I am. The third one, I'm back to being happy. And I'm going up a path and everybody's happy and there's some people around me and I'm in the woods with a little rabbit. That's supposed to be a little rabbit down there. And birds and trees and the sun is out. And that's my future.
That's beautiful. So how do you feel when you look at that last one?
Oh, I love it. I love it. I love in this last year, I've gone walking a lot and I've come to appreciate how silence and the trees and everything is so healing. And I love doing it. And I watch birds and things like that. And it's very healing and I enjoy it. And I first drew myself alone and I said, no, I don't want to be alone. So I drew in more people.
I love it. It's beautiful. Thank you so much for sharing.
You're welcome.
Anybody else want to share?
Oops. I can share, except mine are a little more. Can you hear me?
We can hear you, yeah.
Okay. Let's just say stylized. And I used one piece of paper because if I flip things, I get, all over the place.
Yeah.
Oh, let me see. I might have to take my background off. 1 second. None. Okay. Let's see. Where are we? Can you see? Yeah.
Yeah.
1. Okay.
Yes.
So 1, I guess it's the reverse, but I'm here. I'm just kind of like whatever, hanging out. The one in the middle is basically I have a number of paths and things that are on my mind that I want to solve. And there's no bad path. They're just different paths and it makes it fairly noisy. And the last one is kind of like picking something. But yeah, I'm not much of a drawer.
Everybody's drawing to their own. So how do you feel when you look at the second one? So you with your biggest problem and all that noise. And then there's the third one where you just pick something and you're drawing resolute.
I know. Well, there is always a lot of noise and it helps, this is why I participate in these meetings because it helps with just focusing on something other than the noise. But yes, and you know, it does always feel good to just fix whatever it is, or you know, come to a resolution, knowing fully well that my tendency is to always pick another challenge.
Well, thank you for sharing. I really appreciate it. Anyone else want to share their drawings with the group?
Share my drawings.
All right.
So let's see if I can change my view so I can make sure you can see me. So this is my first one. I am feeling like a melting snowman emerging from winter. I'm following along on the stick figure theme here. So this is 1. 2, my stick figure person is getting out of a rut, the challenge being a rut going in circles and getting deeper and deeper, and the getting out of that is a new path towards sunshine and whatever happiness that the sun represents. And then my third is, again, this really excellent stick figure is standing on solid ground, that being that line, the sunshine, and then nothing else in there representing simplicity, minimalism, clarity, lack of the current fog that that many of us are in, and that's my stick figure.
So when you look at drawings 2 and
skinny there.
When you look at drawings 2 and 3, what are some themes that you notice? Anything that feels important?
The sun, to me, I feel that's very timely right now with the spring being on and being more hopeful and encouraging that things are changing. There's a new light. I like light, being able to be outside, be warm.
Yeah.
Both like the reality and then the symbolism of all that.
Yeah, and I think contextualized by your first drawing, which was you as a snowman, cold, it's really interesting. Yeah. Well, thank you so much for sharing.
Thank you.
Anyone else want to share? We probably have time for one more.
I'll go.
Okay, thank you, Daniel. Or Julie, sorry.
That's okay. So mine is actually kind of specific for my issue. For my drawing, I kind of drew how I was feeling today, which is happy because it's sunny and it's warm and it's spring. And then for my second drawing about how I'm feeling, I don't know if you can see this. It's kind of specific into this year has been really stressful with my job. I work in healthcare at a nonprofit, and it's been really tough, a real tough year working with patients and with funding, and I'm kind of looking for a new job. And so the third would be my happy place, where I would be able to do Reiki and do like integrative medicine and holistic medicine with my patients at a nonprofit and get paid a DC livable wage.
So when you look at drawings 2 and 3, you talk about finding your happy place. What do you think you need to do to get there from where you are now?
Network, which I've been doing, trying to at least.
Yeah. Anything else that comes up for you when you look at those two next to each other? Or
just how burned out I've been over the last year with working with patients that have very high needs, and it's been difficult to try to help.
Yeah. Yeah. Well, thank you so much for sharing, and yeah, for all you are doing to help. So. All right, Janet, I think we can pass it back to Dr. Kogan to wrap it up. Thank you guys all so much for sharing, and yeah, I really appreciate it.
Well, thank you, Tatiana. My drawings are so ugly that I don't think I can show it to anybody.
Oh, Dr. Kogan, you have to share now.
Well, yeah, sure, why not? So I can't draw anything. So I can just draw circles and things. So I think I drew this, which is kind of, just I'm surrounded by friends and loved ones, and I kind of like this state of drawing on energy from support around me. I think my problems are I'm kind of too scattered. So sort of, even though I want to be in the center of energies, but yet a lot of the energy is scattered, and partially it's due to lack of communication and lack of support, and communication is more of a mind problem, that I'm not able to certain personal needs to communicate them well. And solution is more in terms of kind of finding the inner strength to bring it all together. And you probably see there's a lot of sort of circles that are going in a pattern between all three, which is true. I mean, the solution is in the answer itself, in the question itself. So yeah, that's my little drawing. So is Lee here?
Yes.
Do you want to take over? And if we have a little bit of time left, I think there may be more questions, but we don't have to. I think we better take time and update everyone on where things are.
Yes, last week I promised you all an update, so I will give you an update. First, want to let you know that there's still some unknowns and some things that we're figuring out. So this is definitely just a sort of temporary update, and we will give you more information as it develops. But most importantly, I want to thank you all for your support morally as well as financially. We've received some gifts, and we are extremely appreciative of those. And that, coupled with some other fundraising efforts that we've been doing, we now have enough funds to go at least another 6 months beyond the end of May. So that definitely buys us a lot of time and makes us feel more comfortable that we are going to realistically be able to keep moving forward while we secure some of these larger funding mechanisms that we're working on. Yes, it's very exciting. And thank you all for help with that. And the other potential element that we're adding, and this is the one where we don't know how this is going, but the Office of Diversity and Inclusion at GW is looking for a 50% employee, so someone who's at half time. And it could be a really good fit for us to share Janet in that role. Janet would obviously be great at that role, and maybe we could do some work with the Office of Diversity and Inclusion. So that may be something we do in terms of making it a little bit easier to financially support the office and making sure that Janet is taken care of, and that she doesn't have to ever go 50% of her salary and always has a full-time job. So that's something we're also feeling out. If that does happen, we're going to be looking for additional support for this event. I've put some calls out for some current students that we have to see if anyone might be interested in volunteering and helping with this. But if there's anyone out there who is interested in maybe just helping host one of these during the week, or with some of the logistical issues, please do let us know, as that may be something that we need. Anything else on that, Misha, or is that pretty much what we talked about?
No, I think that's good. I think still that if anybody is interested in stepping up and helping to coordinate things and kind of co-run the Friday afternoon sessions, I think that would be a great. And also, we have started thinking through organizing a smaller group that would be insurance-based and billable through any insurance that you have. And that's actually in partnership with Tatiana's Center for Mind-Body Medicine to try to actually create a workings where we would be addressing more medical aspects of care in addition to a steady mind-body. But that would be a much smaller group. It'll be partially educational, but primarily it'll be practical, and it'll be longer, and it'll be based in kind of an ongoing set of tools that are evolved around specific medical concerns. So that's not kind of more of a Q&A. It's going to be more, you have a problem, how do you deal with this? And that's going to be in a small group that will be limited to X amount of probably 10 to 12 people at the most. That seems to be the size when it works the best. So we'll keep everybody updated.
And I think the idea is that that setting might be able to fill in the gaps that this is not able to do. Like sometimes
Exactly.
you have questions that are in depth and more medical oriented, and we can't answer them here. That's what this group would be for.
Exactly. So like that great question about the shingles vaccine, I really need to know someone really well to answer it. And that requires me more medical intervention or interaction with the patient, seeing their chart in front of me and really kind of having much more thorough medical capacity than what we can do here in this group.
Can I butt in for a second? Does Janet get to stay?
Absolutely.
Oh, okay, good. I wouldn't hear that.
Yes, I get to stay.
We were never getting rid of Janet. And I want to thank you all for your support of Janet as well. We love her very much, and it's good to see that you all love her as well.